Welcome friends, revise with me Homeopathic Materia Medica. This revision is from Keynotes and Characteristics of Allen's Keynote, and here we are going to deal with the remedy number 43, Calcarea Carbonica. We are going to have total 8 parts while dealing with this remedy, and this part constitutes the first in the series. Calcarea carb, the common name is Calcarea Ostrearum, carbonate of lime, calcium carbonate, and the remedy belongs to mineral kingdom. The formula is CaCO3. Remedy was proved by Dr. Hahnemann. We are dealing with part 1 here, and this is PQR review. And these red line symptoms are taken, as we know, that from Allen's Keynote, and this is very important for the BHMS students and interns. This is the book which we are going to follow for current text. The symptoms here in this work are given in running text, and each sentence represents a PQR. The only limitation what I find in the text is that it is disorganized in sequence and continuity. So friends, this is the text which we find, and this text is so complete for the clinical purposes that it contains the soul of the remedy, especially from the applied point of view. This text is taken up from Hering's Guiding Symptoms of Our Materia Medica, and he has selected in his practice which came out to be more profoundly effective clinical red line symptoms. It can be best appreciated if you have the background reading of Nash and Farrington's Clinical Materia Medica. So let us go ahead. On going over the Allen's Keynote, we find that it presents about 28 PQRS. And let us go through these PQRS. The PQR number 1 tells us about leukophlegmatic, blonde hair, light complexion, blue eyes, fair skin, tendency to obesity in youth. So it has got, from the point of view of symptom analysis, it is a constitutional symptom having somatic physical attributes and temperamental attributes. The physical attributes you can very well understand. And then we have leukophlegmatic, that is temperament, but there is one more hidden part here. Obesity in youth, that tells us the diathesis, the predisposition of this Calcarea carb patient who has got indisposition, genetic, or you can say since birth, to acquire obesity, especially in childhood only, not only adulthood. These traits are present since childhood only. Now we go to the PQR2, soric constitution, pale, weak, timid, easily tired when walking. Again, this small line depicts the constitutional components like physical attributes, which he translates into our miasmatic understanding of the remedy, that this remedy belongs to Sora, predominantly soric constitution. How soric constitution can be seen? They are pale, easily tired when walking, weak people, and timidness is a mental attribute or temperamental attribute. He also tells us both the components, mental and physical, here. Now we come to PQR3, disposed to go fat, corpulent, unwieldy. This is a diathesis which we had already referenced in PQR1. The patient is predisposed to obesity, childhood obesity, and currently we know that obesity is predisposition to further secondary Problems, medical problems like in particular age group of 40s and 50s, hypertension, diabetes, osteoarthritis, gallstones, and you name it, and you have lot of many lifestyle problems will come across. Anyway, the PQR4 tells us about children with red face, flabby muscles, who sweat easily and take cold readily in consequences. Here again, you will find two components, somatic component, the physical attributes, and he tells about the phase of the life. Children, maybe children who are the child is in the age group of 9 to 14 years of age, before puberty. These are the people who are much more impressed with this remedy. But who are those people who have flabby muscles, who sweat easily, take cold easily? The taking cold easily is a diathesis, predisposition you have. Now next PQR tells us about large heads and abdomen, fontanelles and sutures open, bones soft, develop very slowly. Open fontanelles, you will find the child who is having age group below 1 year, and these children who are infants and their bones are not developing, their skull bones are not meeting together, joining together, sutures are still open because calcium has not been able to deposit. Such kids have large head, boxy head, what we call in rickets, and large abdomen. They develop very slowly. Their physical growth is retarded. That is what PQR tells us. And then we go to PQR6, curvature of bones, especially spine and long bones, extremities crooked, deformed, bones irregularly developed. Now this child, after infancy, they grows into 3, 4, 5, 6 years of age, and because he doesn't have the strong bony bones, long bones are weak, and the muscles are flabby, cannot give the strength to the body or joint. So skeletal system and muscular system, both, they are deficient in terms of the strength. That is the reason the muscles who needs to keep the vertebral column straight upright will not be able to do so. These long muscles are weak muscles. Erector spiny muscles are weak muscles. So spine will become curved. And if the long bones like tibia, fibula, femur, all these bones in the extremities, or even if you can say radius and ulna, they will bend if you put pressure upon them. So they are deformed bones, especially you will see in children during the developmental course. PQR7 tells us head sweats profusely while sleeping, wetting pillow far around. And some of the remedies which are important, they are silesia and sanicula. So this is a peculiar symptom of Calcarea carb, where sweating is marked in the head region during sleep. PQR8 tells us about profuse perspiration, mostly on back of head and neck, or chest and upper part of body like silesia. So sweating is also on the localized part, especially back of head and neck, chest, upper part of the body. It is a physical general perspiration. PQR9 tells us difficult and delayed dentition, which characteristic head sweats and open fontanelles. So he talking about the primary dentition. During dentition, delayed dentition is taking place, and other features which concomitantly present here, head sweating and open fontanelles, tells us about the diathesis of the Calcarea carb in terms of bony development, and this diathesis points to indirectly rickets also. So let us go to the next important PQR, which is 10, during either sickness or convalescence. Great longing for eggs, craves indigestible things like and aversion to meat. So these are the few features which belong to desire and aversion. So these are also general modalities, especially in relation to the food which we find. These are very strong symptoms of Calcarea carb. Next one is PQR11. Acidity of the digestive tract, sour irritations, sour vomiting and sour stool. They belong to particular general, they belong to GIT only, but however you find next sour odor of the whole body like Heper and rheum, we find it correspond to physical general also. So this is a physical general symptom. Now we find PQR12, girls who are fleshy, plethoric and grow too rapidly. So at the time of puberty, especially females, if they belong to Calcarea carb, they are fleshy and plethoric and they are growing too rapidly. So it tells about constitution and sex also of the Calcarea carb, where it can be important remedy. In PQR13, menstruation too early, too profuse, too long-lasting, with subsequent amenorrhea and chlorosis, with menses scanty or suppressed. So this young girl who is growing very fast starts menstruating but subsequently develops amenorrhea because she develops chlorosis. Too profuse, too long-lasting menses will lose hemoglobin and she develops chronic anemia. With chronic anemia, menses get suppressed. So it is a primary amenorrhea, maybe because of severe anemia. We have to keep in mind. While reading PQR 13, we go to PQR 14. Woman, menses too early, too profuse, feet habitually cold and damp, as if they had on cold damp stockings, continually cold in the bed. So adult female is also having the same problem. Menses too early, too profuse, menorrhagia is there and they are chilly, long extremities, having poor blood circulation and they are chilly in the bed also. Even if they are covering up themselves, they find it doesn't relieve them. PQR 15 is the least mental excitement, causes profuse return of menstrual flow. Corresponding similar remedies are sulfur and tuberculinum. This is an exciting cause, especially in case of female. We find mental excitement will bring about menstrual flow is a very peculiar symptoms and includes ailments from PQR 16 tells us fears. She will lose her reason or that pupil will observe her mental confusion like ectia. So this is a mental general, especially of Calcarea carb. PQR 17 tells us about lung diseases of tall, slender, rapidly growing youth. Calcarea carb patient, predominantly they are obese patient, but please, there can be some of the Calcarea carb patient who can be tall, slender, rapidly growing youth. And here what happens, the upper third of the right lung, often the guide to the constitutional remedy than phosphorus. What involves here is upper one third of the right lung. It is a tubercular deposit, tuberculous patient who generally, if you see, lean, thin, tall patient, sensitive patient, we think about phosphorus, but he gives us a choice that it may be a young child who can be a patient of the Calcarea carb. So be careful. Please simultaneously also see tuberculinum and other remedies which have the upper left lung involvement is myristica and sulfur. So we have this rubric, this PQR, very important PQR, which tells us about the tubercular predisposition of Calcarea Carb child or Calcarea Carb young person. PQR 18, diseases arising from defective assimilation, imperfect ossification, difficulty in learning to walk or stand. Children have no disposition to walk and will not try. Suppressed sweat. So two things are there in this particular PQR. Because of defective assimilation and imperfect ossification where bones are weak, muscles are flabby, so child has got no strength to stand up and walk. So because of weak extremities, the child will not try to walk, stand up and walk, and he will have delayed walking and moving around, and concomitantly you may find suppressed sweat is suppressed, then probably these features are much more profoundly active at that particular phase. So it is a diathesis. PQR 19 tells us rawness of sole of feet from transpiration and gives us to compare graphitis and senicula. Blisters and offensive foot sweat. This is a particular general where lot of perspiration takes place on the foot. We have PQR 20, longing for fresh air. When in a room which inspires, benefits and strengthens like pulsatilla and sulfur. This is a physical general where in spite of the fact the patient is chilly, would like to have open air which helps him to feel better. Now PQR 21 tells us coldness general of single parts. Either coldness in general is there or even in single parts like calibi, head, stomach, abdomen, feet and legs. Aversion to cold open air goes right through her. Sensitive to cold, damp air, great liability to take cold, opposite of sulfur. So sulfur is a important king of antisoric remedy. Calcarea carb is also antisoric remedy. Here it is chilly, sulfur is hot, and there is coldness in general and single parts, especially with Calcarea carb. PQR 22 tells us about sweat of single parts, head, scalp wet, cold, nape of neck, chest, axilla, sexual organs, hands, knees, feet. So sweating can occur in particular areas at one particular given time. PQR 23 tells us about the pit of stomach is swollen like inverted saucer and painful to pressure. This is a particular general belonging to GIT. PQR 24 tells us about uremic and other diseases brought on by standing on cold, damp pavements or working while standing in cold water, modelers or workers in the cold clay. So this exposure to cold acts as an exciting cause or ailments from where there is subclinical diseases which are there, they are suddenly excited. They are brought on the surface. If there is a chronic renal failure, it will become acute renal failure. This exciting cause is important. So PQR 25 tells us about feels better in every way when constipated. When constipated, this is a very, very important physical general and it is a peculiar symptom of Calcarea carb. PQR 26 tells us about stool has to be removed mechanically. Such a stubborn constipation we have in case of Calcarea carb, that mechanical removal of stool or fecal matter is required. because most probably, as we see, the voluntary muscles are flabby and weak. Similarly, the intestinal or circular muscles or involuntary muscles are also so weak that they are having very weak peristalsis, and the fecal materials remains inside the rectum for a long time, and it consolidates, and the constipation becomes very marked. The Ellen tells us to see other remedies for comparison where constipation is there, like aloes, sanicula, selenium, sepia, and silesia. PQR 27 tells us about the painless hoarseness, which is worse in the morning. It is a particular general belonging to larynx, and we have PQR 28. Desires to be magnetized like phosphorus. This is a very important symptom of Calcarea carb. Let us go to the next relationship. The complementary remedy to belladonna. Calcarea carb is complementary to belladonna, which is acute of Calcarea. Calcarea acts best before Lycopodium, Nux vomica, phosphorus, and silesia. It follows nitric acid pulsatilla in sulfur, especially if the pupils are dilated. It is followed by calibi in nasal catarrh. And according to Hahnemann, Calcarea must not be used before nitric acid and sulfur may produce unnecessary complications. And in children it may be repeated very oftenly. However, in old people should not be repeated, especially if the first dose benefited. It will usually do harm. That is the cautious note we have. And then we go to the aggravation, general aggravation, cold air, wet weather, cold water from washing like antimonium crudum, morning during full moon. These are the few things which aggravate in general, and amelioration is by dry weather, lying on painful side like bryonia and pulsatilla. So thank you very much for your patient listening.